Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Nita Valens, how are you today?
Great, and yourself?
Living it up as always. Why don't ants get sick?
Ants don't get sick because they hide in their pants.
No, it's because ants have antibodies.
Oh, that's a good one. That's
Isn't
a good
it?
one.
But you're not laughing, so you have to get more.
Oh, dear. Well, can we at least give the phone number? Someone can rescue me, maybe?
Yeah, 866-870-5752. Give us a call right now to learn about pain syndromes, things in your body, musculoskeletal disorders. That was a good tongue twister.
Yeah, that was good. Orthopedic issues, basically.
Orthopedics, right. So the whole key to what I do, the work that I've done my entire medical career, is save people from getting surgery they didn't need. And a lot of surgeries are done, as we know, that come out bad. All you have to do is look at Google and search for that. Look at the results of orthopedic surgery. And again, I say it every show, I love orthopedic surgeons. It's not against them. It's just the culture of orthopedic surgery is really, to me, not very healthy. There are many times when it's drastically needed. And those are the guys to go to right away.
And gals.
And gals, guys and gals. That was a movie, wasn't it, or something like that?
I think so.
Before you were born.
Yeah,
Nita.
Absolutely. I read about it.
Yeah, so if you want to talk to me now about your musculoskeletal pain or about your friends or family, please call in. Otherwise, I'm going to torture Nita with some terrible jokes that she's not going to get the answer to.
That's usually the truth.
So our number here right now is 866-870-5752. And by calling in, I am going to send you postage free, everything free, a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I'm looking at it in my hand right now, and it is, what is this, almost 200 pages, and it's got 264 researched studies that have been posted in journals, peer-reviewed journals. And it's all about how PRP, which is platelet-rich plasma, and stem cells work to regenerate and heal tissue and injuries, and why surgery may not be the best answer for you, and why your MRI and X-ray and CT scans don't really tell you the truth about why you're having pain. And the studies show, because we take people that have no pain at all. Okay? That's people that are asymptomatic. And we say, can we do an MRI on your shoulder, your knee, your back? And when we do that, we find all kinds of terrible syndromes there, but the person has no pain. So if you have pain and you have something on your MRI or other scan, that doesn't mean that is the reason or the area where the pain is being generated from. And the thing that I do is touch the body and examine it and get a good history to find out really where is your pain coming from. Once I find that out, I can inject that area under ultrasound guidance. That means that we use an ultrasound that looks inside the body. It's an immediate scan. I don't have to send you anywhere. It's right on wheels, on a table. We roll it into you. And I take a look inside and I can tell what's going on. It's very good for guiding the needle. I had a gentleman come in yesterday with his wife. They both did platelets and stem cells on their knees, and I was injecting under ultrasound. And the woman had had a steroid injection in her knee that worked for a few weeks, and then the pain came back worse. And I said, did the doctor use an ultrasound? She said, no. Why would he do that? And I said, because you can't see without an ultrasound. And I showed her the teeny little spot, like half of a millimeter, that the needle had to touch to get into the joint capsule. It's impossible to get into the right spot with your knees, your hips, your shoulders without an ultrasound guiding you. Those areas are teeny weeny. So a lot of times when you're given shots into these areas, they're not going into the right spot. And that happens often when people's knees blow up and when they get a gel injection, hyaluronic acid, because it didn't even go into the joint, it went into the soft tissue. When that happens, you got a real problem. So let me get to the phone number here for the office also. It's 800-300-9300. Nita, you're breathing.
I forgot. Sorry, I'll stop.
There. So yeah, to get to me at the office is 800-300-9300 if you want specific information we didn't get to on the show. But if you want to talk to me right now, I would love it. Nita and I love our callers.
We do.
You can call 866-870-5752. That's 866-870-5752. And get a talk with me right now about your pain syndromes, about your rotator cuff tears in your shoulders, about whether or not you should get a surgery, about meniscal tears in your knees, about herniated discs in your back, about neck pain, back pain, arthritis, your wrist pain, your fingers. It doesn't really matter what part of the body. I inject all of it. There's no place I don't inject in the musculoskeletal system. If you're having things like any kind of a disease issue, I'm not going to do IV stem cells. I don't do that. The FDA doesn't love that, so I stay away from it. And I think it could be a good thing for some people, but typically it's not going to do the job that they think it's going to do. A lot of people leave the country and they get IV stem cells. They feel great for a week. They spend 30 grand or so to do it. I don't know why they're doing it, because it's not going to do much. So be careful what you're doing, what you're buying. It works great for orthopedic injuries. So once more, the phone number to call me right now, 866-870-5752.
Okay. And the website is? www.lastemcells.com. And you can email Dr. Darrow off of every page on the site, as well as watch him performing the treatments on videos. And what's the most important thing that happens when they call the program today?
They get a free book called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It took me 5 years to put this book together, to put together all the research that shows how regenerative medicine using platelets and stem cells works. Platelet therapy is called PRP. You've heard that term. It's out in the news. A lot of pro athletes are getting PRP or stem cells, and it's something that you don't need to leave the country to do. You don't need to spend a fortune to do. You can do it right here. We're in Los Angeles, right across the freeway, the 405 from UCLA on Wilshire Boulevard. And we got Mike here. He's got hip bone and femur issues. Mike, this is Dr. Marc Darrow. How are you today?
Mike, are you with us?
Yeah, can you hear me?
Yes.
Yeah, now we got you. Talk loud. Yell at me. I understand that your hip and your femur bother you.
Can you hear me now?
Yeah. How long has your hip bothered you?
Well, it's not me, actually. It's a friend of mine, and it's her mother.
Okay.
96.
Okay.
And she, I was calling for her because the mother didn't really want to talk about it because she's 96. But what the situation is she was out and about, and I guess she fell, and apparently there was a fracture or break in the hip area.
Yes.
Which kind of disconnected the femur.
Sure.
And she actually did have an operation,
Okay.
and they did put I guess a pin in there to
Yes.
hold the leg to the hip.
Okay, that's a good thing. That's the kind of surgery I like to see happen. Are there still problems with it, Mike?
She's still in pain, but
Okay.
she can stand, but not for very long.
And how long ago was her surgery? How many weeks ago was
I
it?
think it was about. I'm guessing now. I think about 3 years ago.
Oh, 3 years ago. Okay, so that probably has healed pretty well by now. But then there's the issue possibly with the joint that's causing a problem, or it could be an area on the side of the femur called the greater trochanter. And when I say words like this, if you've never heard them before, you can write them down and then pull up google.com and type in the name that I'm giving you. And then on the top left of Google, there's a spot that says images, and you can actually see the anatomy and see what's going on. I would have to examine her because the hip area has many different things that can cause pain. It can be the adductor muscle where it attaches to the pubic bone. It could be the joint itself. It could be the greater trochanter where there's a lot of tendon insertions and bursa there. There's 14 attachments there. So there's a lot going on. And sometimes people say hip, and what they're really talking about is the gluteus medius muscle right on the top of their butt. So we have to find out by touching the area where the pain is coming from. I don't trust MRIs or X-rays or CT scans to tell me what's going on. I like everybody to get them because sometimes we find things that we didn't know were there. I mean, I found cancer a few times, lymphomas, things like that, different kinds of cysts that need to be surgically excised. But you should tell your friend's mom that she needs an examination by someone who does the kind of work I do, regenerative medicine, because we get to the root of where the pain is being generated from, then we know how to fix that. So I don't know what the story is with your friend's mom at this point. Just because she fractured her hip, that doesn't mean her pain today, 3 years later, is coming from the hip joint or the area where that fracture was that was surgically pinned. So, I say that I don't like surgeries for orthopedic surgery. I like these kind of surgeries when a bone is broken. That saves lives. Because if you don't do that, you can bleed out, or you can have a fat embolism. There's fat in the bones that can leak out and get into the lungs or the heart and cause an embolism that can kill people or go to the brain. So these are surgeries that need to be done right away, but most of the surgeries being done are for things that don't need to be done, things like meniscal tears in the knees, labral tears in the hips, rotator cuff tears in the shoulders, labral tears in the shoulder, things like that we can heal without surgery. And the surgeries, in my humble opinion, should not be done at all. They cause more problems down the road than any good they do. A lot of times people feel better for a while, and that was the case with the woman that came in yesterday. She had a surgery many years ago on her knee, and her husband did also, and they both came out worse down the road. It felt good for a while, and the husband actually had 3 surgeries on his knee, and both of them had a lot of fluid in their knee, which I aspirated and then injected both of them with platelets and stem cells. So that's the answer for your friend's mother at this point. She needs to be seen by someone who does regenerative medicine. If she wants to get to me, the office number is 800-300-9300. And if you say that you came in through the radio, I'll get her right in the same day. Okay? You can also go, Mike, to the website, which is www.lastemcells.com, and you can watch me doing stem cells or platelets on the hip itself, and you can see what these procedures look like to see if it's something that your friend's mom would want to do.
So you're saying that even though she already had her hip operated on, and they put a pin in there to regenerative medicine can actually still help her, or maybe?
Yeah, I mean, what she had done was not the hip joint. The femur was fractured, from what you're telling me, because they were able to pin it up. I mean, I don't know. I'd have to see an X-ray to see where those pins are. Sometimes they don't go anywhere near the joint. It's not needed to irritate the joint. But sometimes they have to go through the joint itself to stabilize it. So I don't have enough information to tell you what's going on at this point. But like I said, the hip area is so complex with so many different things that can happen to it that I wouldn't know what to tell her just by talking to you on the phone today, on the radio.
I just wanted to be sure that she could actually come in and you can have a look-see. And
oh, yeah, I'd love to see her. I could probably tell her in 2 minutes what's going on.
Okay.
But again, that would be by examination and touching the area and finding out if it is actually the hip joint or if it's the greater trochanter or gluteus medius or iliolumbar ligaments or all of these things people call the hip, and they're not really the joint. Does that make sense to you? If you just Google hip joint, and look at the upper left corner where it says images and click on it, you'll see that the area is very complex, and there's many things that are near the hip joint that cause pain but are not the hip and not the hip joint.
Does the fact that she can still stand and walk a little bit, with some pain, of course, for the walker, does that mean anything?
Yeah, it means it's better than if she can't. It doesn't mean anything about where the pain's being generated from, though, no.
Okay.
I mean, there's plenty of people in walkers that have pain when they walk when it's not even related to the hip joint. That's just one of the potential issues.
Well, she is in some pain when she's sitting, or sometimes even when she's laying down. I don't know if that means anything.
Well, it's the same thing I get all day long on emails from my website. And by the way, if anybody goes to www.lastemcells.com, they can email me from every page there. I get emails from all over the world every single day, which, by the way, I answer every day. I spend a lot of my time answering emails with people. But one of the most common things that I hear in an email is, can I send you my image? Can I send you my MRI, my X-ray, my CT? And then you can tell me what to do. And I go, no, that won't tell me. I need to examine you. And a lot of people who come to me with failed surgeries, I get tons of people, tons of new patients that come in after a surgery and they got worse. And I say to the surgeon, touch your body to examine you. And they said, no, they looked at an MRI or an X-ray and decided from that I needed a surgery. And that, to me, shows you that you can't decide on doing a surgery based on an image.
Okay.
So, Mike, now I have a question for you. How old are you?
Myself, I'm 70, the big 70.
And are you an athlete at all?
I used to run. I was a track runner, but other than that, nope.
Okay. So is your body feeling pretty good? Do you have any pain areas?
No, I'm good. No, I've no pain areas.
Well, that's wonderful. Well, God bless you, Mike. I really appreciate your call.
Anyway.
And give the information. Give my office number to your friend whose mom is 96, and that's 800-300-9300, or have them go to the website, which is www.lastemcells.com, and they'll get tons of information there.
Okay, thank you very
All right.
much. Thank you.
God
Thanks
bless
for
you.
your call, Mike.
Thank you so much.
And our number is
866-870-5752. Talk to Nita and I right now. We can answer a lot of questions about your musculoskeletal pain, your orthopedic pain, whether you've had a surgery or not, whether you want to have a surgery, whether you think it's a good idea or a bad idea. I can help you decide potentially. And in my book, there's too many surgeries being done that shouldn't be done. Why do I think so? Because I get people who come in all the time who have had a surgery that made them worse. So, when you get a knee surgery, typically you're ending up with arthritis immediately because tissue is being removed that is good tissue. And sometimes these clean-out surgeries make people feel good for a while, and then later down the road, things get worse than they were before the surgery. So I'm very, very cautious about getting surgery. Unfortunately, I had one on my right shoulder my 4th year of medical school when I was doing orthopedic surgery. I had my boss inject me, operate on me. He shaved down my acromion, which is the top of the shoulder, cut a couple ligaments, and my arm blew up like a balloon. I had a high fever. I was terrified, and it never really healed. I had about 4 years before I learned about regenerative medicine, and when I learned about it, as an experiment, I injected my own shoulder, and all of that misery dissipated overnight completely. I had full range of motion and no more pain from one series of injections. That's one time. Poked my own shoulder. My wrist was actually done before that, and I had a golf injury where I hit the ground instead of the ball, and my wrist hyperextended backwards, and I had pain with that. I injected myself and healed that up also. Since then, I've done my knees, both shoulders, the wrist, both elbows, and because I can't reach my neck or back where I've had pain before, I don't now, because I've had it injected, I've had other buddies of mine do it for me. So a lot of times when we go to national meetings on regenerative medicine using platelets and stem cells, we get together and inject each other. We trust each other.
That's great.
So I'm going to give out the phone number once more, then I'm going to go to questions here.
Okay.
Get a hold of me, get a free book on stem cell and platelet therapy called Regenerate, Don't Operate. And the phone number is 866-870-5752. You get a free book when you call in. Suzanne Summers, the beautiful actress, wrote the foreword to the book. She's a great fan of my work. Thank you, Suzanne Summers. I worked on her for years and on her son Bruce and her grandkids, and I've had very great success with them, and I get very great success with most of my patients. So let me go to a question. Actually, I'm going to do one more joke, Nita. Let's torture Nita. That's more fun than questions, isn't it?
Oh, I don't know. I think we should help people.
All right, so, Nita, this will be an easy one.
I can't wait.
When is your door not actually a door?
When it's a jar.
Oh, my God, you've got your thinking cap on. Bingo! Good job, Nita.
Thank you.
Have you been studying?
No. What's to study? Where do you get these things? I don't know where you get them.
Okay, you did so well. I'm going to ask you one more. What did one dish say to the other?
Dish me.
That's close. Dinner is on me.
Oh, like that one.
You didn't laugh, Nita, so guess what?
Okay, it's almost our break time, so we should probably start with a question.
All right, I'll let you off the hook here. Question time. Let's see what we got here. It says chondromalacia patella. It's a great Latin term. So chondro is cartilage, and malacia is from mal, which is bad. I took 4 years of Latin, so I know all this stuff.
Oh, that's scary.
Every doctor took Latin back in the day, or Greek. So chondromalacia means bad cartilage, and patella is the front bone in the round bone in front of the knee. And the term chondromalacia is really not a good term for what's going on. It means bad cartilage, but really what the story is the patella sits in a groove in the femur. Okay? Hang with us, folks. We'll get to all this soon. Call in right now so you can talk to us. We're going to the break. It's 866-870-5752. You can call my office at 800-300-9300. And we love you all. Please call in. Nita, anything from you?
Yeah, you're listening to Living Pain Free with Dr. Marc Darrow. Grab a pencil, write down this information. I'm Nita Valens, your host, and we'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.